Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to continue my series on sexually transmitted infections, and I'm going to be covering syphilis. Before I get started, as always, I'm going to ask you to please support me and my channel by liking this video. You're going to love it, so press that like button now. Subscribe to my channel if you haven't done so already, and don't forget I have audio lessons available on my website, nexusnursinginstitute.com. All right, guys, so let's get started. I'm going to make this a little bit larger for you. Let's take a look. Syphilis. Now, it's a sexually transmitted bacterial infection that can cause serious long-term complications if not treated effectively. So, one, bacterial infection. This is an infection that a $2.99 antibiotic can clear up. But if the problem with syphilis is that many patients who are infected with syphilis won't even know that they have syphilis until it's too late. So even though an antibiotic that's less than $5 could clear this up, a lot of patients that have syphilis and they don't get the antibiotics that they need, they end up dying from this disorder, from this disease. And it's not a fun disease to have, okay? It has some very serious long-term complications. So let's talk about it. Let's talk about the etiology and patho. So it's transmitted via direct contact with syphilitic lesions. This is what's known as canker. Oh, I forgot to put my phone on silent. Give me a second, guys. When you guys see that word canker, automatically, I need syphilis to be at the forefront of your brain, okay? It's you'll see the patient will have a lesion that's known as a canker, and it can occur externally on the genitals, the anus, the lips, or internally in the vagina, the rectum, mouth, or tongue. Now take a look down here. Look at this. An infected pregnant woman can transmit syphilis to her fetus during pregnancy, and they're at high risk for stillbirth or having babies who develop complications after birth, including seizures and death. Clinical manifestations, signs and symptoms. And remember, guys, a big problem is that with syphilis, it's insidious. So, the patient may be asymptomatic, or they might not even know that they have syphilis. Look at this. It says syphilis is called the great pretender. Why? It can infect many organs in the body and present itself in a variety of signs and symptoms that might mimic another disease. So you'll see a cluster of signs and symptoms. What do we know that as? A syndrome. And we may think it's another disorder that's going on with the patient, and the whole time it's syphilis. Syphilis is more difficult to recognize compared to all the other STDs. Syphilis is very hard to recognize, okay? Remember how at the very beginning we saw it noted that there are very serious complications of syphilis? Look at what I wrote here. If no antibiotic treatment, if the patient does not get treated with antibiotics. Look at this. Complications of the disease occur mostly in late syphilis. The gammas of the late syphilis may produce irreparable damage to the skin, bone, liver. So we can see in cardiovascular syphilis, the patient can have aneurysms, scarring of the aortic valves. Neurosyphilis, we'll see that it'll invade the patient's central nervous system. They can have visual impairment. They can have dementia. I'm going to move on to the next page. And guys, if you notice that on my videos lately, it looks a little bit different with the camera. The reason for that is when I used to, go over the book, I used to just have the book lying down flat, but now I have really bad pain in my neck and I just can't look down anymore. So I have to use a book elevator. So I'm still learning how to manipulate the camera so you guys can still see what I'm looking at without looking down, okay? Okay, again, cankers. Remember when you see cankers, that's a type of lesion. I want you to think of syphilis. Those cankers on the genitalia enhances HIV transmission. If a patient tests positive for syphilis, go ahead and test them for HIV, okay? Look at what it says. Patients with HIV and syphilis appear to be at greatest risk for clinically significant CNS involvement and may require more intensive treatment than other patients with syphilis. Diagnostic studies, blood tests, VDRL, that's a venereal disease research lab. That's an RPR, rapid plasma reagent. And this RPR, that's the most common test that is done for syphilis. Management, we're up here, look at the management. Antibiotic therapy, penicillin G benzathine, okay? Now, if that patient is allergic to penicillin, can we give them something like a cephalosporin? Absolutely not. Remember, if they're allergic to penicillin, we're not giving them a cephalosporin, and they're allergic, to cephalosporin, we're not giving them a penicillin because of possible cross allergy. So we give penicillin for this disease, but if the patient is allergic, it's going to be contraindicated. What are we going to give? Doxycycline. If the patient's allergic to penicillin, our go-to is going to be doxycycline when it comes to this, okay? What else are we going to do? Confidential counseling and testing for HIV infection. Repeat of what does it say? I have no idea this word right here, test. Okay, repeat of the test in 6 and 12 months. We need to make sure that this patient, that this bacterial infection has been cleared and that they don't get reinfected. I don't have the time now, but someone look up that word. Tell me what it means in the comment section. Non-treponema. I can tell you that we do have to retest them. All right, drug therapy. Again, penicillin G, that is the recommended antibiotic that the patient gets. But if they're allergic, they're going to get doxycycline. When penicillin is contraindicated, doxycycline or tetracycline may be used. Let me ask you something. If we're given tetracycline and the woman is of childbearing age, what are we going to look at before she gets that? We're going to look at that HCG. We're going to make sure she's not pregnant, right? Right. All sexual contacts from preceding 90 days should be treated presumptively. So we don't have to confirm that they have it. We don't have to confirm they have syphilis. If they had sexual contact with those people, we should go ahead and just give them antibiotics presumptively. Reexamination and follow-up testing is recommended every 6 months for up to 2 years. Objective data. This is measurable assessment information that you can see in that patient with syphilis. For NCLEX purposes, painless. Not only do they have a canker, it's painless. Painless canker, you better be thinking of syphilis. Okay? Because guess what? Look at genital herpes. They're going to have painful genital or anal. Look at the word vesicular. When you see that word vesicular, you need to be thinking of viral infections. And we know that syphilis is what? Bacterial infection. Okay? So painless canker, syphilis. Painful vesicular lesion, herpes. Genital warts, look at this. Multiple gray or white genital or anal warts, and usually for testing purposes, they'll be described as cauliflower. It looks like cauliflower lesions. When you see cauliflower-like lesions, you need to be thinking of genital warts. Possible diagnostic findings. Now, this I've already covered on my other videos when I've gone over the different sexual transmitted infections, so I'm not going to repeat that. Let's look at some nursing interventions. Be prepared to discuss safer sex practices with all patients, not only those who are perceived to be at risk. These practices include abstinence, not having sexual intercourse, monogamy, having sexual intercourse with just one person, avoiding high-risk sexual behaviors, and the correct use of condoms, that barrier method, and other barriers with every single sexual contact. Sexual abstinence is the only certain method for avoiding all sexual transmitted infections, but few people consider that to be a feasible alternative to sexual expression. Measures to prevent sexual infection. Sexually transmitted infection. You're going to encourage patients to take notice of a sexual partner's genitalia. Yeah, turn on the lights, look down there. Take a look before sex. Pay attention to any discharge, sores, blisters, rashes. Remind patients that most sexually transmitted infections may have no symptoms, but they can still be transmitted. Proper use of a condom provides a highly effective mechanical barrier to infection. Refusing sexual activity with any partner who will not use a condom is a safe and legitimate option. One more thing, let's take a look at this box. Sexually transmitted infections. So when teaching the patient with sexually transmitted infections, you want to explain precautions to take, such as using condoms and other barrier methods. Look at what they say, with every single sexual contact. Again, be monogamous, only have sex with one person. Ask potential partners about their sexual history. Ask potential partners if they've been tested for sexually transmitted infections. Avoid sex with partners who use IV drugs or who have visible oral, inguinal, genital, perineal, or anal lesions. This is a biggie. Look at this. Voiding and washing genitalia and surrounding area after sex, immediately after sex. Why? You want to flush out some of those pathogens, organisms that can expose the patient, expose you to infection. Explain the importance of taking all antibiotics or antiviral agents as prescribed. Teach them the need for treatment of sexual partners, because guess what? If they're the only ones taking the medication and they go have sex with the partner, they're going to reinfect themselves. So everyone needs to be treated. And instruct patients to abstain from sexual intercourse during treatment and to use condoms or other barrier methods when sexual activities resume, to prevent, again, spread of sexual transmitted infection or reinfection. And guys, that is your syphilis in a nutshell. This video is a little weird because if you watch my other video from before, yes, work is still being done in my studio. So I'm down here in the living room. That's what it is until it gets done. So I wanted to make it work because I didn't want to wait until it was done in order to make more videos for you guys. So please forgive me for it, but I really wanted to make sure that I still was able to produce content for you. Let me know what you guys thought about this video. Let me know what you'd like to see me cover next. Don't forget, I have audio lessons available on my website, nexusnursinginstitute.com. And almost daily, you guys can watch me cover a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching this video, and you guys will catch me on the next video.